Community from Lisa's Chanceville. I hope you like that one there. Meantime, very good morning to you for those of you who just happen to join us right here on TRAXXfm. This is Momentum, and as you know, on Mondays it is Health on Momentum, giving you the topics with regards of health. And today having Renuka Rahoo. Now, she's a pharmacist from Hospital Sultan Ismail, Johor, Bahru. And today's topic would be polypharmacy, the alarming risk of mixing common medicines. Very interesting topic. Stay with us right here on TRAXXfm as we will get deeper into what polypharmacy is all about. And once again, our guests in the studios, thank you to my producer, Barid, and Renuka Rahoo. A very good morning to you. Welcome to the show. How have you been? How was your morning preparing for the radio show? I'm sure there was a lot of excitement, isn't it?
Yeah.
How has your day been anyway? How's your morning been? Yeah. Okay, so Renuka is going to get comfortable and yes. Can you hear me clearly now?
Yeah.
All right.
Yeah.
Renuka, how has your morning been? How has your preparations been? Getting exciting for radio?
Good morning, DJ. Thanks for having me here. Exciting, yes, but nervous also. This is my first experience to be in radio studio, actually.
Nice. Okay, so welcome to the show. Thank you so much for being here with us, taking time off and being here. Renuka, now just before we can get into today's topic, which is polypharmacy, which is an alarming risk and where people mix their medicines. But we would like to know a little bit about you. You are a pharmacist from Hospital Sultan Ismail, Johor Bahru, and it's been really the distance coming here to the capital city. Welcome to Kuala Lumpur. Welcome to TRAXXfm once again. Tell us a little bit about yourself.
Okay, thank you so much, DJ. Okay, before I introduce myself, I'd like to say this. I must say that this program, Health on TRAXX, is a great eye-opener for the community. So, yeah, I think it's a fantastic effort from, TRAXXfm. I would like to congratulate
Thank you.
The team, for the entire team for this effort.
Thank you.
Okay, I'm a geriatric pharmacist from Hospital Sultan Ismail. Geriatric management and care is my passion. I'm also a clinical pharmacist. I manage my usual routines will be at medical ward, but my primary scope is in geriatric management.
Okay, and how long have you been with your profession? How long has it been?
It's been 10 years, but into geriatric management is almost 4 years.
Okay. And, well, today's topic seems to be very interesting, Renuka, and I was reading a little bit about what polypharmacy means and getting a little bit more elaborated on that yesterday as I got all the details. But for our listenership, could you please explain to us what polypharmacy, what is it all about?
Okay, polypharmacy refers to a condition when a patient takes more than 4 types of medication simultaneously. Okay, the key here is simultaneously to treat one or more disease or other health condition. Okay, this list of medication includes OTC drugs, which means sometimes we do purchase Panadol flu medicines, right? So this list also includes OTC drugs, prescription medicine, traditional and also complementary medicine used by the patient. Okay, polypharmacies can be categorized into appropriate polypharmacies and also inappropriate polypharmacies. Appropriate polypharmacy refers when all the medicine prescribed is actually indicated, meaning to achieve a specific therapeutic objective that agrees with the patient. So in this case, although patients have to take various type of medication, this list will improve and enhance quality of life for the patient. On the other hand, inappropriate polypharmacies refers to medicine that prescribed without proper justification. So what happens here? The accumulation of medication will lead to extensive or unnecessary medication that unlikely to help to achieve the health goal for the patient, and will provide and lead to potential harmful effects. Okay, so the goal of polypharmacy, the goal is to reduce inappropriate polypharmacy and to ensure appropriate polypharmacy. So therefore, it's important during initiation of a treatment to consider appropriate polypharmacy at every initiation point of treatment and also during each transition of care for a patient. However, polypharmacy is not only defined by use of the quantity of a medication. There are also various other categories that used to identify polypharmacy. There are such as use of medicine without proper indication, use of medicine which have similar therapeutic effect or which have similar mechanism of action to treat a disease, use of medicine which may have interaction among them, and use of inappropriate dose, and use of medicine to treat side effect of another medicine. Yeah, I hope it explains.
It does. It gets very in detail, but this one here, especially to our listeners who just got on board, thank you for tuning into Momentum and Health on TRAXX as we are talking to Renuka. Now, Renuka explained to us on what polypharmacy is actually about, but what might possibly happen if a patient takes different types of medication all at once?
Okay, usually patient can take most of medicine simultaneously with other medicine. However, in certain scenarios, taking certain type of medicine with other medicine may interfere with the effect of the medicine. So this will lead to adverse effect. So among the adverse effects that may occur due to polypharmacy will be like increased risk of medication errors, non-compliance, increased risk of side effects, increased hospitalization rate, increased risk of drug interaction, and increased treatment costs. So medication error itself is a huge topic. So let me just, simplify it here. Okay, medication error can occur, may occur, and it may occur at home. And this error may made by patients themselves. Okay, how does it happen at home? By miscalculating the dose, by repetition of the doses, like you repeat or double the dose of medication, taking a medicine once it has expired, or having inappropriate storage, or error derived from not having the correct information about the medicine, or confused with the instructions. We have labels on the medication.
Correct.
We are confused with the instruction, or forgotten what the doctor or pharmacist told about the medicine. So in some cases, this error can lead to severe damage that may require a new pharmacological treatment management, or that needs hospitalization. Or in other scenario, it may lead to fatal consequences. So, especially for elderly population, the risk of medication error is higher because, not to be ageism, but generally, as we grow older, we have decreased vision, poor ability of hearing, and, we tend to forget easily, or declined or impaired cognition. And most of elderly, sometimes they'll stay by themselves. So they have to handle the medication by themselves without caregivers, Other than this, seeking treatment from several healthcare facilities, what we call when a patient have multiple TCAs. Okay, what happens here? When patients have multiple TCAs, when they seek medication from different facilities, they tend to have accumulations of medicine. So what happens when you have accumulation of medicine? You can easily get confused. That's one. It is quite a concern, especially if they take same medicine, but with a different brands. Because sometimes we have medicine with different brands. They may differ in shapes and colors. So you will not know it's a different brands, but it's the same item. So this can lead to overdose issues. Okay, besides this, polypharmacies are also associated with non-compliance issues. Okay, this is not surprising at all. See, when you have 10 medicine to manage, the more the medicine is, it's harder to manage the medicine, to handle the medication. So you tend to forget or skip the doses. So this will lead to non-compliance. Okay, another thing is when we have 2 or more medicine, the chances to have drug interaction is also more. So that's why it's always important, especially for doctors and pharmacists. We will screen through all the patient's medication during our TCAs. So at this point, it's important for the patient to enlighten us regarding any other medication that they consume at home. For example, supplement, vitamins, even herbal medicine. It's always important to enlighten your doctor or pharmacist. So when we make a decision, we can have best possible outcome for the patient. Other than this, indirect effects of polypharmacy will be like increase hospitalization, increase treatment costs, and reduce effectiveness of the medication due to the interactions.
Right. Okay. So, whatever that we do, it's always best to, number one, get advice from the doctor and always brief him, right, on what are the types of medications that you're on or that you're on. But when I was surprised when you also said, even vitamins. It's very important to let your doctor know that you're on, probably boosters or anything like that. You should also be telling them, right?
Yes, definitely. Because, for example, when you tell us about a vitamin or booster or,
Right.
sometimes, protein drinks and
Yes.
so the pharmacist, we will check the ingredients. Okay, sometimes some boosters, they may have steroid. I'm not saying all, but they have steroid contents in it. Okay, some vitamins like vitamin K, it can have interaction with prescribed medicine. So it's best to inform your doctor. You have professionals, so let them do their job.
Right.
We are here to help the patients anyway.
Don't hide anything.
Yeah, don't hide anything. Do not hide. No need to be shy. Just feel free. Yeah, share us your issues.
And always visit the doctors that you see. It always has to be the doctors. Probably stay with the same doctor. Is that also another advice?
Preferably yes. It's best to stay with the same facility. However, we have to understand sometimes it's not possible due to distance or, that particular hospital doesn't have that service. So the patient will be referred to another. It does happen here. It's okay, but...
a track record of the medication that you're on.
Having a proper records, having at least, snapshot of the pictures. Everybody has smartphone now, proper recording. That will really, really help. If you can stick to a particular facilities, please do so.
Right.
Yeah. If you can, yes, please. That will be the, point number one.
Priority.
Yeah.
Yes. Okay.
Stick to the same doctor, same pharmacist.
And always tell them what you are on or what has your medical history been.
Yeah, and
That's
always
very important.
agree, totally agree. And always share your goal. What do you want? What do you want? What do you expect? From your treatment.
Okay, that's very important. Talking to Renuka Rahoo, pharmacist from Hospital Sultan Ismail, Johor, Bahru. And today's topic, really interesting and momentum on Mondays as we give you health on TRAXX. Polypharmacy. Now, this is an alarming risk of mixing common medicines. And producer Bahru, thank you so much. We've tackled two of these questions here. What exactly is polypharmacy and what possibly might happen to a patient if they take or probably take different types of medication all at once. Explained by Renuka. Thank you so much. But we've got more coming up, and we're going to talk to Renuka and to find out more or get into details on who is at risk of polypharmacy and the reasons behind it, and also should we practice or should patients practice various types of medication? Is it advisable or it isn't? All this and much more when we come back. Stay tuned, don't go anywhere.
Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face to Face with our guests on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. only on TRAXXfm.
Coming at you from My Chemical Romance, the ghost of you right here on TRAXXfm. Welcome to Momentum. A very good morning to you. 32 minutes past the hour, and today, as you know, Momentum gives you health on tracks. And as we are talking to Renuka Rahoo, she's a pharmacist from Hospital Sultan Ismail, Johor, Bahru. And today's topic, really interesting, polypharmacy. As Renuka explained to us what polypharmacy is, the alarming risk of mixing common medicines. And that seems to be something which is really alarming, especially when you are into various types of medication. And while Renuka did explain to us even in further what happens if a patient goes overboard with different types of medication all at once. Welcome back to the show. Hi Renuka, very good morning to you. And yes, again, now here is this one here that we are talking to our listeners who are listening in to us. What is the risk of polypharmacy, Renuka?
Okay. Generally, polypharmacy are common among older adults because they have a multiple chronic condition. Okay, multiple chronic condition here defined as two or more chronic conditions. Usually, older adults, they tend to have arthritis, hypertension, diabetic, and depressions and all. So all these particular diseases have their own management itself. So here we can see why this group of people have multiple medications. And adults age 65 and older tend to have more medicine compared to other group of age of people due to the health issues and a health problem. Other than this, other patients who may be at risk for adverse polypharmacies are those who have one type of illness that require medication treatments. Okay, and those who keep taking various herbal medicine, traditional products, keep purchasing OTC drugs, and also patients who takes unregistered medicine or seeing, as I said, multiple TCAs or multiple facility treatments, and those who have vision, hearing issues, and also those who have a cognition impairment, and last, and those who live alone. So this group of people are at risk of polypharmacy.
Okay. There you go. So now with all this risk that individuals face sometimes, especially when they're having various kinds of what should I say, complications with health. Okay, and especially with the elderly, and as you did explain, Renuka, that sometimes they have to go on this medication to cure this particular problem that they have, and then they have to use this different kind of a medication to cure that kind of a problem. So it really gets too much, and they're just swallowing all those pills and all those medication in there, and sometimes overdose, like what we said earlier on. We were talking about this, being overdosed, not having enough of that particular prescribed drug or medication. That also can be an issue, and that's why they always have this little containers where you put different days with different kinds of the pill box. Yeah. And that's also kind of an important. Just to give you experience that I have with one of my aunties. Now she has various kinds of this, but she has this whiteboard, and she writes when is the next appointment with the doctor, or what is the medication that I should have at this particular time, this particular day, things like that. Just a small reminder that you should have on your board. School kids have those sticky notes that stick everywhere, especially for history and things like that.
I'm happy to hear that.
So she has that, and she even has quick dials on the telephone. Okay, if you dial 1, you will be getting the first daughter. You dial 2, you'll be getting the eldest son, who knows more about all her prescription. So I think that's also another little advice that probably our listeners should also take. A small little whiteboard, have everything written down there. Try to use the permanent markers and not the temporary markers. That's also another tip there. But Renuka, now what should be practiced by patients who need to take various types of medication? I just gave a few examples, but I think you as a professional, you should know better. And probably your advice. Yeah.
Okay. There are several things patient can practice to manage their medication. The keywords are to be careful and organized. I think your auntie is like amazing.
Yeah, she got it all. Daughter got it for her. Yeah.
Very good.
She keeps the board there. Yeah.
Very good. So yeah, as I said, as you go elderly, your family support is actually very crucial over there. Among the other things that patient can do is possibly to stick, as I said earlier, to stick, possibly to stick at one facility to get your treatment and one facility to receive your medication. Okay. If you can't, then what you can do is have a proper recording of all your list of medication. All list of medication that includes your OTC drugs, your vitamins, your supplement, your herbal medication, all lists, and the list supposed to be up to date. And each time when you visit a doctor or pharmacist, please show them the list so that they can review accordingly. And then keep the medication prescription properly. It's very, very handy. And in like our KK, we have the book, green book, Please keep the book properly and bring it along upon your TCAs with doctors and pharmacists. And record all medication taken. As I said, all your medication, your supplements and all. And keep it with you. And sometimes I do understand that patient, they have difficulty to remember the name of the drugs. So what they can do, create a folder in your smartphone and just have the pictures. So you can just show to your doctors or pharmacists, then we can do our analyzation from the pictures and inform doctors or pharmacists when you want to take a new medicine that you feel like you want to take. Okay, I think I need this calcium pills. What's your advice, doctor? What's your advice, pharmacy? We have community pharmacists here. I'm very sure they'll be, they will be happy to help and advise, go to them, seek advice, all that. And another very, very important step is always read the label properly. Follow the instruction. Focus on the dosing and also timing that mentioned at the label. Keep the medicine in the original package. I understand, we have our patient who organize medication with the pill box. Yes, we totally get it. It's okay. It's good because the pill box is supposed to aid in the medication management process. But then do keep the original packaging at a different container maybe. Because, when you need to refer back, I've forgotten this one's supposed to be night or morning, go back and, you have something to check there, as your reference. And avoid buying illegal medicines from illegal sources, Facebook. So please, no, don't do that. And do not share your medicine with another people, do not share medicine.
Hey, come try. This one boosts up your energy, man. Just give it a try.
I'm telling this based on my experience. My patient has told me, my friend is feeling much better after taking this medicine. So she passed it over to me. So I took it. And then what happened? You have to end up coming to hospital because of the medicine. So do not share any medications.
There you go. And before you take anything, always read about it. Preferably check with your professional with a professional or with a doctor or even with the pharmacist. Yes. And it's very important, right? I've walked in my experience walking into a pharmacist. To get something. Probably I'm having a small flu or something like that, and she always will advise, okay, this is what it contains. Do you have any allergies or these are some of the important points that you should be always letting your pharmacist or even your doctor know, right? Especially with allergies and things like that.
Yeah.
And it is very important. So there you go. A little risk factor of what Renuka explained to us if you happen to know about polypharmacy, and also the right practice that should be followed by patient. Now, besides all that pill box and things like that and all that, and I just gave you a few tips. Have that whiteboard, have it all jotted down. And please remember, tablespoon and teaspoon. Yeah. Oh, doctor said can take 1 tablespoon. There you go. It's supposed to be 1 teaspoon. Okay, so this is some of the problems that probably you might face. And Renuka, just before we've got these 2 more questions, just one particular question here, and then later just an advice to our listeners. When we come back, we'll be talking to Renuka and on how polypharmacy can be avoided. Now, we spoke to her with regards of all the pros, the cons and all that. But now let's take a look at how polypharmacy will be avoided. And, she'll be sharing with us a few tips to help prevent problems caused by multiple medication interaction in older or elderly patients. So in a bit, stay tuned with us to our listeners. And when we come back, we will be giving you all you need to know about polypharmacy. Stay tuned.
Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face-to-face with our guests on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. only on TRAXXfm.
Okay, welcome back to the show. Hey, hi, a very good morning to you. And, welcome back to our topic for today, which is polypharmacy, the alarming risk of mixing common medicines. And we are talking to our pharmacist, our guest in the studio from Hospital Sultan, Ismail, Johor, Bahru. It's been a distance traveling here, being with us in the capital city right here in RTM. And we are so pleased to have her, Renuka Rahoo. Thank you for taking time off and being here with us as we are talking about polypharmacy. As Renuka explained to us, what is it all about, the risk factors, and little tips and advice that Renuka gave as a pharmacist on how to be careful, especially when you are practicing polypharmacy. Now, Renuka, here we go. Now, this is the question that everybody, or probably I was waiting for this one here. How can polypharmacy be avoided? I mean, if you don't have to take those drugs or medications, how can this be avoided? And probably, can you please share with us some tips to help prevent problems caused by multiple medication interaction in older or the elderly patients?
Okay. All right. The thumb rule is to be careful. Okay. How do you avoid polypharmacies? You have to be careful while you handle your medications. Okay. And as I has been telling, ever since this topic started, first thing first, always discuss with doctors or pharmacists, before you would like to get any medicine, and also always have a professional opinion on your medication list, and bring all the medications during your visit during your visit, TCA, when you meet a doctor or a pharmacist.
Very important.
And and I would like to tell this again. Please use our community pharmacists. What I mean by use is like, go to them. You can, when you purchase vitamins or something, you can ask their advice. We have community pharmacists. That's one of the role of community pharmacists to support medication management, at community base. Another thing is like, read medicine label carefully. It's very important to read the medicine label carefully. Just not like you said 5 ml, teaspoon or tablespoon. Yeah. So you have to read the label carefully. Focus on the timing, focus on dose, and frequency. Like you have to take it, on 2 times daily or 1 time daily, or before meal or after meal, Please read the medicine label carefully. If you have any difficulty to read the label, inform the pharmacist when at the dispensing counter. I'm sure they will at least write it bigger for you, And also seek medical attention immediately. If you experience any side effect due to medicine, and do not stop any prescribed medicine, without doctor's instruction. I would like to share another thing. Other than this, my practical advice, being a geriatric pharmacist, my practical advice will be during consultation and also counseling sections when you are with pharmacists and doctors. Patients' involvement in sharing problems and issues related to medication handling is very, very crucial. Meaning, please address the issue that you have when you handle the medication. For example, I had a caregiver who shared with me that she shared with me that giving 3 times medicine to her own dad is too taxing. she can't do that.
Okay.
Eventually, what happened? She skipped.
Yes, cut down the dosage.
She cut down herself the dose because her dad gets agitated when he sees the medicine. They start to have quarrels. So she skipped the medicine. So when she addresses this issue, somehow as pharmacists or doctors, we will try to, simplify. We did simplify the regime for her. And the other day, she walked out with, simple single dose regime. And we also consult the dad. So the pointer is inform what are the difficulty that you face when you handle the medication. Either you are a patient or a caregiver. Because as I said, when we have dementia patient, it's not easy to give them medication. When we have older patients who are depressed, it's difficult to give them medicine. Okay. So compliance matters. No point of prescribing 5-10 items when you can't comply to the list of the medication. Yes. So the ultimate goal is when you have compliance, then you achieve, your best possible outcome with the medical benefits.
It's very important.
Yeah.
Okay. And as we were talking to Renuka, now she shared tips on how to help prevent problems caused by multiple medication interactions in the older patient. And as I said, always talk to the professionals. That would be very important. Renuka, just before we go or just before we leave you, thank you so much for taking time off, being here, sharing your point of view on polypharmacy, which is an alarming risk of mixing common medicines. And your final advice that we should take home, a message for all our listeners.
Okay, I'm going to have a little longer message here.
All right, there we go.
Okay, we have to understand, polypharmacy has been described as a significant public health challenge. Okay, and inappropriate polypharmacy is a growing concern, especially for older adult patients. Okay, so in short, we have to remember that medicine are meant to help, not to harm. But sometimes taking too many drugs or too many medicine can be dangerous, especially for older patient. So patient and public members kindly discuss your issue, your concern with doctors and pharmacists so we can have optimal treatment outcome. Okay, although patient need to take various type of medication, in some situation they have to because, sometimes they have multiple issues. So they have, longer list of medicine. So practice proper medication intake to avoid unnecessary issues, to avoid inappropriate polypharmacies. And here I would like to share the contact. We have a National Pharmacy Call Center. Okay, you can reach, patient can reach at 1-888-67-22. It's open Monday to Friday, 8 to 5, except on public holidays. Okay, these are one of a way where you can reach out, seek help when you need. Other than that, for example, when you are taking medicine from a particular hospital, that particular hospital will have emergency pharmacies, and emergency pharmacy runs 24/7. So you can immediately, anytime you can call up and, ask, to clear a very quick doubt if you have any. Okay. Beside this, as I said earlier, use your, consultation or counseling section time. Share your difficulty with the pharmacists or doctors. Do not be shy because we are here to help actually. That's our job, So please cooperate with us, let's have a proper optimized management.
Amazing. Thank you so much, Renuka, and her advice for us to take back. And if you happen to be in that circle, polypharmacy, and yes, all the advice that we gave you today on our show, Health on TRAXX. Thank you so much, Renuka, Rahoo. Pharmacist, Hospital Sultan, Ismail, Johor, Bahru. Thank you for being here with us. It's amazing to have shared something which I just learned this particular word yesterday, polypharmacy. Because I'm a type of person who probably don't need any medications at the moment.
Touch
wood, yes. But yes, it was something really interesting, and to know the tips, the points. I've seen my mom, I've seen my aunt who is into polypharmacy. I mean, they've got no choice due to health deterioration and things like that, cataract, arthritis, and so on and so forth. But it's amazing to find out something which is so simple to understand, but many of us are ignorant about this polypharmacy, and we just mix everything up, and sometimes even underdose ourselves or overdose ourselves and things like that. Thank you so much once again, Renuka, Rahoo.
Okay.
Thank you for being with us here on TRAXXfm.
Thank you so much for having me here once again. Thank you. And keep on doing this health,
Yes, we will definitely do it every Mondays. We have Bahru here.
Yeah, it's actually a very good program because, when we speak at radio or maybe at TV, the reach is, higher.
Yes,
and,
definitely.
Education, creates a better awareness among the community.
Thank you.
So, congrats. Good job.
Thank you. We will always keep it going. And Mondays, as you know, it's on Momentum. It is Health on TRAXX. Producer Bahru, thank you so much. And when we come back after the midday news, it's more music coming up your way. Stay tuned. Don't go anywhere. This is Gilbert on Momentum.